Hey guys, Dr. Josh Jagoda here, and today I'm going to show you what it's like to adjust the mid to upper back. And this is a really important area to adjust here because a lot of people have a lot of tightness up in the mid to upper back because it's the connection between the neck and the mid back, and because of poor posture and things like this where the head goes forward and the back becomes rounded, what we were talking about with seated postures, what we're going to do is have all these neck muscles pull really tight in order to pull this person back. Relax for a second. And so what's going to happen is that these neck muscles are going to go forward, they're going to want to pull back, and so a lot of people will complain of neck tightness and tension. But actually, in actuality, is that the neck may in this person be really fine, and the mid back right around here below the scapula might be okay, but this transition area where all the tension is building may not be okay. So what we need to do is do some soft tissue work, rehabilitation advice, mobilize that area, and today I'm going to show you what it's like to mobilize that area because it feels amazing. People get extraordinary results, and it's just from this one mobilization or adjustment. So let's go onto your belly and we'll show you how that's done. So this patient will be face down, and what we're going to do is we're going to put this table into a neutral, if not slightly flexed position. So she's going to relax her shoulders, and I'm going to have her slide down just a tad. And so this is the area, right? Usually between C7 and T4. But really, we're talking about the thoracic spine, so this area. So first things first is we'll take our hands and we'll push right on each side, and we'll just mobilize each side right next to the spine, just like that. And the patient will breathe with you. And then we're going to do the same thing on both sides. Just to at least start the mobilization technique, we'll kind of come out a little further, have the patient completely relax their hands, and we'll come off onto the rib heads. And you'll find how beneficial this will be for that patient. Just this alone will do a ton of benefit for that patient. Now, if we want to get some more of that counter rotation and that rotation factor in order to maximally stress this area and really release it, what we'll do is we'll figure out where we need to adjust first. And in this patient, you can tell that this side's a lot tighter on this left side of this patient here. So right here, we have a lot of different contacts, but what we'll do is we'll lift the head just a tad and we'll rotate it. We're not overly rotating it, but we're going to take our hand and we're going to place behind the neck, and we're just going to do the same thing. Good. Just like that. And this patient is really tight right here. And now if I'm going to turn my back to the other area, this is what the adjustment would be like. So we're going to come in, we're going to take my hand right here. So the first mobilization that we did and the second mobilization, we're going to combine them together. We're not going to scissor the head or anything like that. It's actually a very quick adjustment, but it looks as if it's not comfortable, but it's actually quite comfortable. Especially, so the patient will take a breath in for you, and all the way out, and relax. Good, just like that. Good, perfect, just like that. And then we'll stretch them out, give them some rehab. So this is a great adjustment for anybody who sits too long, is having upper back, neck pain, headaches, things like that, or if they're having some shoulder issues or scapular issues up through here, because again, this is a key transitional piece of the spine that is really under addressed in chiropractic and in physical therapy. So this is a huge area that we take care of in our office. All right, guys. Thanks for stopping by. Hopefully this gives you a little bit of insight about what we do in our office and how you can help mobilize your upper back and your neck to help prevent these pains. All right? Thanks for stopping by. We'll see you next week, and don't forget to subscribe to our channel. Bye.